So visiting Gaza for me has been a very humbling experience. There's sort of layer upon layer. There's the challenges of actually just getting through what is equivalent of 3 security checks. My Gaza friends will often welcome me saying, "Welcome to the open prison of Gaza." And behind that humor, there is 15 years of siege. There is a sense of just real struggle. Electricity blockouts, difficulties with accessing healthcare, huge difficulties with accessing healthcare, the sense of unpredictability. When is the next problem going to have? Children who struggle to even sleep. So there's all of that suffering, which is very real. But on the other side of it is some of the most hospitable, welcoming people that I've ever met. And there's a sense of, if you have come, one medical student said to me, when people like you come and see us, it makes us feel more valuable. So I have that dual feeling of feeling very humbled, struggling a bit with what you see and why this is the situation for people. But on the other side, I look forward to going because the welcome they'll say is, "My beloved sister, welcome." That sense of relational interaction. I'm from a different place. I'm, different background, and yet I'm welcomed as a sister because together we're trying to address the suffering of the people of Gaza in a small way. I'll give you an example of some of the people I've met. Dr. Sobi Skeik is a very famous surgeon who has operated through some of the wars and difficulties there in Gaza. He met me many years ago and we were talking about palliative care, and people were saying to me, "We have so many problems, why should we take on palliative care?" But he said very quietly, "Our people are in pain, we have to act." And what has happened now is there is a brand new cancer hospital opened just in December 2021. He's the director. And we're planning a number of programs together to help the patients there in the hospital, but also to develop training programs. And he said to me, I have 2 reasons. 1, I want my people in Gaza to have help. And 2, my brother didn't get the help he needed and I had to watch him. And when he was dying, he didn't have the pain control and the support. And that's why I'm supporting you. Then I'll tell you another story. Dr. Fadel Naim, he is the Dean of the Medical School, IUG. He told me about his 18-year-old son who was a medical student during one of the wars. He said, "I don't want to fight, but I want to help." So he carried stretchers, but unfortunately those ambulances were destroyed and he was killed. And what really struck me was what he said to me was, "That is why one day these walls must come down and we live as brothers. Why should all our sons die?" And he himself wants to design a medical school program that is about healers, not doctors. Very interesting. So when I first went to talk to him about palliative care, there was no problem. He said, "No, that is exactly what we want. We want things that connect our humanity to our science." The medical students in Gaza we teach, they are hardworking. If I ever say I like a kanafa, kanafa is a very nice sweet. I'll find the next day their mothers have all cooked me kanafa. They'll bring it, that lovely sense of family. But also when I asked them, "What does palliative care mean to you?" And we taught them, and we taught about communication skills and how to interact with grief and loss. And they listed all of the things they loved about palliative care, but one student said, "I think this is humanity until infinity." Now, he was being a little clever, superhero stories, but actually underneath all of that was this sense of, I think in Gaza what I see is a deep sense of humanity. When other things are stripped away, when the situation is uncertain, when some freedoms are very much restricted, people turn to the most important things in life, to family, to faith, to what connects us as human beings, to what our values are. One of our young doctors who was a teaching assistant in the university, he took us to meet his mother. And she made us makluba. Makluba is a lovely dish where you turn it upside down to serve it. Makluba means upside down in Arabic. And you sit together and you eat together. You eat with your hands together. Such a lovely way of eating. She said to him, every day when you leave this house, don't think of yourself as a big, important doctor. Remember your mother and treat every patient as if they are your mother. Let me tell you about a couple of patients. So Muhammad is a young man. Now, he did fight in one of the wars and saw his friend die beside him. Very painful experience. He himself, just in his 20s, developed jaundice, liver problems, thought maybe it was an infection, but there also had been some shrapnel that was left in his body after the war. So there was some doubt. Anyway, he was diagnosed with liver cancer. And liver cancer is a cancer that is not very treatable, but there was some chemotherapy options for him, but not within Gaza. Now, the reality is, even if you have all the medical forms filled in and the referrals made, and even if the hospital you want to go to is just like 1.5 hours away in East Jerusalem, at least half the time, something happens and you can't go, some red tape that stops you going. Sitting next to him was his father, and his father was so upset. He was so angry, so distressed. But when I looked at Muhammad, he was kind of quiet. And so I had medical students with me. They found the story hard. There were some tears. And I said to Muhammad, tell me what in life is most important to you. He said, my son. And what had happened was that because of the cancer, actually his son and his wife were no longer where he was. It was very painful. So I said, show me a picture of your son. And I have this lovely image where he showed me his son. He told me his hopes and his dreams for his son. I think he knew the cancer would progress. He knew that he couldn't leave to get treatment. And maybe even if he left to get treatment, it wouldn't make a difference. But we had connected over that very human story of a father and his son. I think of a little boy. He had leukemia. Ahmed was his name. Now, to get treatment for leukemia until now, the international community and the Gazan community are trying to change to make sure their treatment for cancer can be within Gaza, because traveling outside Gaza is so difficult. But this little boy, we had medical students again on a ward round, and I said to him, tell me what you understand about your illness. And he said, I think I have cancer in my blood. He's about 9 years old. He said, I have been outside and I've had a lot of treatment, but the cancer has come back. And I think maybe I'm going to die. And you can imagine the tears all around the room. So we talked a bit and he said, but it's okay as long as I don't have to leave my family again. Because the reality is, if you're a child and you have to leave for treatment, maybe you'll get the permission to leave, but your mother can't travel with you. You know, they don't let the first-degree relatives travel. And that's very, very painful. But we also talked about what he loved in life. And actually, it was Manchester United Football Club. So he had the shirt, he had so, you know, it is that combination of touching things that are hard. They're very hard. Talking about situations that are painful, but also that sense that what is there to celebrate is life itself, and love, and relationships, and family. My colleague there in palliative care is a doctor called Dr Khamis Elesi, and he is really doing a brilliant job in leading on palliative care. But when I spoke to him recently about his motivation, his own father had cancer, he had had surgery, but again had to leave Gaza for that surgery. He was being looked after. I mean, what I see is healthcare workers all over care for patients. The politics are separated from the healthcare workers, but he couldn't travel with his father. So they're talking over the phone. His father's condition is deteriorating. My friend is feeling quite desperate, and actually his father died. So he died in a hospital there in Israel, but with no family members around him. And I think at that point he said, for my father, I want to take care of other people's relatives, other people with cancer, but I want to see if we can take care of them here in Gaza. So the approach of palliative care, in some ways, I feel there is a commonality across the world. How it is delivered depends on the circumstance. What are the priorities depends on the circumstance. So in sub-Saharan Africa, diseases like HIV are very common. In Gaza, we have, just like India, we have cancers are very common. In fact, some of the highest in the world, non-communicable disease, but we also have trauma, some of that trauma related to war. So we will have pain problems related to that. I think what I see almost in every setting, but maybe more so in Gaza, is that when life is difficult, when you strip away the things that normally help you cope, your finances, your stable home circumstances, your job, your sense of a future, what is left behind? Now, in many ways, places that have been living like that, they may have really discovered some of that deep humanity, which is about sharing, being together, valuing family, the hospitality you offer guests. That is particularly acute in somewhere like Gaza. But I have to say, I see that also in palliative care, other places, because when we have a serious illness, all those things we thought we were going to rely on, we can't anymore. Maybe the difference is that some places have been experiencing that for longer, so they maybe even have more of those resources. But also in Gaza, there is a sense of exhaustion for that too. So there's those two things combined. It's a deeply, deeply human place. And it's a place where I feel very honored to be welcomed. I'm not seen as somebody different or other. We even had a discussion with some of the imams. They came to a conference, and we were talking about how palliative care is perceived. And my Arabic is very poor. I shouldn't even try, but the words in Arabic for palliative care is kindness care, taltafiya, kindness care. And they deliberated, they listened, and then they came back and said, okay, we see two things in this palliative care. We see mercy and we see dignity. And those things for us as imams, as Muslims, are very important. So we want to now support palliative care. And to me, that was a really important moment of connection. So in palliative care, we look at those domains of palliative care, but we also look at it within a cultural context. And as a visitor, I don't know that context. What I find fascinating is that even in a similar area, even for example in Kerala, there will be slightly different ways of looking at that if you're in different parts of Kerala. The same to some extent in Gaza. But what I see is in every context, it does make sense because all of us experience serious illness. All of us have relatives that have died. All of us at some point have to think about what gives us hope and meaning. What I've seen in Gaza is because of that, of the ongoing struggle, there is a real sense of togetherness. Faith is very important. I've met also Christians in Gaza, and many from the Orthodox tradition, for example, and a lot of commonality there too. They say we are Arabs, we are Palestinians. But for many, the sense that God is in control, or that ultimately it is God that they look to, is a great sense of hope and reassurance. And of course, in palliative care, what we seek to do is let people talk to us about that, share, see where they are suffering, whether that is spiritual suffering, whether that is physical suffering. And if we can relieve that suffering, if we can't relieve it, at least we can promise to walk alongside and not abandon people. One outcome of that conference with the imams is that now some of the spiritual care providers are actually coming into the hospital, and that wasn't done before. And that was lovely to see, But when I go in the ward round in the hospital, one time that little boy I told you about, the one with telling me about his cancer, as we came out of the room, a clown team came in. So they have a clown team that come to the hospital. There was so much fun and laughter and joy. And the kanafa that the students had brought to me from their mothers, I then shared with the children in the ward. So that's what I'm meaning, is that combination of, a deep sadness for those of us who visit that I can leave, but my Gaza friends can't. they say to me, we feel so sorry for Ukraine, but we're glad they can't leave when the bombs fall. They said in the beginning of COVID, because I was there, they said, tell the world we know all about lockdowns, we'll give them some tips. So there's that lovely, lovely humor, but underneath it, it's really hard. And it's hard for me to imagine why this goes on year after year after year, and there is no resolution to this, because these people want to live as brothers. And my colleagues in healthcare, they want to care for their people. And I really feel that 2 million people caught in this situation should really attract more attention. So I think in all of palliative care, we are accompanying people at those difficult times of their life, hopefully with a lot to offer. So there's, number one, there's the privilege of having something to offer, and bringing hope into situations where people feel they are hopeless. And that is a huge privilege. I think you are so right. There is also a sense in which we can take on that suffering. And I think we need to be aware of that. We need to be building our own resilience, building our own health, making sure our networks, formal and informal, are strong. Perhaps more than any place, Gaza actually does leave me feeling that combination of such warmth because of the welcome I've received and the work we're able to do together. We're about to embark on developing postgraduate programs. There's the medical students and the nursing students are some of the most hardworking I've ever met. So there's a real joy about working with my colleagues, but there is a sadness. I often just spend a few days still in that area of Palestine and just spend some time reflecting. For me also, my faith and prayer is important, just some way to kind of let it settle a bit. But also for me, the next step is, if there's something I can do in my small way to make the situation more visible in terms of palliative care and to help care for some of those suffering, then that gives me a deep sense of satisfaction.